just keep praying that I just stay on the right track. I want to so bad.
On today's All Things Heart, a family in despair, a teenager desperate for help battling a brutal addiction to a potentially deadly drug. We explore the problem gripping communities across America and right here in Kansas City.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, October 13th. I'm Alexis Delcid. Welcome to All Things Heart. Coming up today, we're talking about fentanyl. Addiction specialists say fentanyl is a driving force behind overdoses in teenagers across America. Doctors, law enforcement, drug counselors all say that they regularly see people overdose, even die from taking just one pill or even half a pill. And now this as we head into Halloween. Rainbow fentanyl. The DEA says it recently seized 15,000 of these candy-colored pills laced with fentanyl in New York City, hidden inside Legos. And a former DEA official warns of fentanyl found hidden inside packages of candy. It's just chilling. And as you can see from these pictures here, provided to us by the Kansas City Police Department, plenty of the drug has been seized right here in the metro as well. So today we're exploring the addiction, the often deadly consequences, and all the resources that could help you right here if you or a loved one is struggling with this. And we always want to get your questions answered. Please send them to us during this episode on YouTube, Facebook, or the All Things Heart email. We will ask them live. You can find those links right here on your screen. The family you're about to meet is 3 generations. A teenage girl, only 17 at the time of this interview, her mom, and her grandma. It's the teenager who's battling addiction, but it has overtaken the lives of everyone in her family. And as you're about to see, there is a 4th life at stake in the most literal sense.
17-year-old Clara, her mom Ashley, and her grandma Gina are clearly exhausted. 1 year ago, Clara was in school with lots of friends, playing sports, and a 4.0 GPA.
She's a completely different person on this stuff. She will lie to get what she needs. She will tell you what you need to hear so that she can get what she needs. And before that, Claire was not like this at all.
I can't not work. I have 2 other children too. I'm about to lose my job. I don't know what to do anymore.
I wish I would have never known about it.
Clara's talking about pills commonly known as Perk 30s, a 30-milligram oxycodone-based street drug mixed with fentanyl. The fentanyl frequently kills people.
My fear is she's going to get a hold of one and she's going to be dead. That's my fear.
You're chasing after the high you get the first time, and you're never going to get that again. So you just keep trying and trying and trying and trying.
They're all here at the University of Kansas Health System's Addiction Clinic for an appointment with clinic director and psychiatrist Dr. Rupa Sethi.
So how are you doing? A little rough.
Clara has relapsed. She hasn't been taking her Suboxone as prescribed. When taken properly, Dr. Sethi says Suboxone will suppress cravings. But there's something else.
I'm just angry at myself because I'm pregnant.
At the time of this interview, Clara is 6 months pregnant, a baby boy, due November 20th.
I mean, you tell me, I don't know if this continues, God forbid, the baby's chance of survival.
There is harm to the baby every time she does use.
I don't want to do it. I don't want to, but sometimes it's just hard.
An addiction so hard for Clara to overcome, fear drives all conversations.
This is the point that you got to think about not just yourself. You're carrying a baby.
Everything scares
I
us.
literally just told you yesterday, I want to do better, I want to change, I want to go to church, I want a job, I want to do this.
There is no saving her. We can't save her, okay? Her mother can't save her. I think the whole point is this fentanyl is It's such an addictive drug.
That's why I don't open up to you guys sometimes, because you guys don't understand.
Lives derailed, a family fractured, and the ultimate consequence always looming.
No, it's not that we don't understand, Claire. We get it. But what we're afraid of is one day you're going to do something and we're going to be burying you.
It's tough to watch that. Joining us today is psychiatrist and the University of Kansas Health System's Addiction Clinic Medical Director, Dr. Rupa Sethi, and we have cardiologist Dr. Travis Love. Thank you both for joining us today. We did invite the patient to join us on today's program. She has declined. She has since turned 18. Dr. Sethi, under these circumstances, are you able to give us an update on the patient?
For reasons of confidentiality, I'll just hold from it.
Okay. Completely understandable. I want to get right into this about the deadly aspect of this fentanyl, Dr. Love. So my first question for you is, we've all heard the warnings that even taking half of one of these pills can kill you. What is happening inside the body that is causing your heart to stop so quickly from taking just half a pill?
Yeah, so the opiates depress your respiratory drive and your ability for your body to not only get oxygen, but get rid of carbon dioxide. And that's typically the mechanism in which leads to death, is respiratory failure, which can ultimately lead to cardiac arrest. But it's respiratory failure that's the primary issue.
So it's not really weakening your heart, it's getting you in the respiratory area, and then ultimately your heart stops?
Correct, yeah. I mean, your heart, needs oxygen to survive. And so if there's any compromise in the respiratory system, you're not getting oxygen delivered appropriately to your heart.
And one more question along these lines is that fentanyl is regularly used as a very effective painkiller in hospitals across America. So is the fentanyl itself what's dangerous? Because it's used in so many other circumstances.
Yeah, I mean, I would defer a little bit to Dr. Sethi here, but fentanyl is essentially a very powerful opiate, and the problem is its power and how strong it is. We use it all the time for different procedures and for pain in the hospital, and do so very safely. It's very effective at what we need it to do. But in the hands of people who aren't trained medical professionals, it can be lethal.
And Dr. Sethi, we've talked about this, is that you never know how much is in one of those pills. That's why you could break it in half and one kid takes it and is fine and the other kid overdoses.
Right. So fentanyl is about 50 to 100 times more potent than morphine. Having said that, normally when we do morphine or other drugs, we do them in milligrams, and this one comes in micrograms. So a very, very small amount is as effective as a bigger amount of the other opiates that are available. However, the ones that are illicitly pharmaceuticals, fentanyl that is being synthesized these days, comes in these tablets which are in milligrams, and if somebody has not been exposed to that fentanyl before, could potentially overdose and die.
I want to ask you about Suboxone. It's that drug we learned that the teenager is on to stop the cravings. Could Suboxone harm a baby, a fetus?
So I would say no. And the reason is, when somebody is using maybe fentanyl or heroin or any other opiate, and if they are pregnant, then they go through the high of getting the drug and then withdrawals from the drug. The withdrawals are potentially more harmful to the fetus or the baby as compared to anything else. When we put this medication on, first of all, it's the generic name of this medication is buprenorphine. It just goes and sits on that opiate receptors, just like the other drugs were doing, or a fentanyl was doing, and then it partially activates that receptor. So when I say that, it means that it'll cause probably no cravings for this patient, the patient will not have withdrawal symptoms and will not end up using again. That is really, really beneficial because the ups and downs that the baby was going through stop, and it is good as pregnancy progresses.
To keep it stable.
Absolutely.
How common is it for you to see teenagers and young people coming into your clinic these days?
So a couple of months ago, and I've talked about this, we were a 19 and above clinic, but we were seeing more and more patients come to the emergency department who were between the ages of 15 and 19. So we actually changed our age range to 15, and we have started accepting patients 15 and above. And
Wow.
I already in last 2 or 3 months have about 22 or 23 patients between that age range. Yes.
That is horrifying. What percentage would you say, if you had to guesstimate, of your patients are hooked on the pills laced with the fentanyl? You treat all sorts of addictions. What percentage are you now treating when it's fentanyl?
So I can tell you almost every intake that I do when somebody comes in for the first time, I would say about 90% of those people just answer M30 or fentanyl, fentanyl powder, fentanyl tab that's available. So it's a non-pharmaceutical fentanyl that's available on the street.
And Dr. Love, are you seeing more people come in who have OD'd from this, or would that be more of an emergency department thing, or do they not even make it to you because they've passed?
Yeah, it's typically more of an emergency department issue,
Yeah.
and then if if moving past the emergency department, it would go to the medical ICU or to an internal medicine team. So not something we typically deal with in the cardiac intensive care unit.
I want to go to some of our viewer questions and questions from the community, because we're getting quite a few of those today and in advance of this episode as well. This is Marie for Dr. Sethi. Marie writes, where on earth are they getting the pills? Do your patients tell you? That's a good question.
Yes, our patients tell us a lot about where they get it, and mostly patients tell us that it is illicitly available on the street, coming from other countries. These are not prescription medications, so these are not somebody else's prescription. These are they're also called the fake pills, and they're being synthesized somewhere outside of United States, and then being imported in here, and then being sold to people.
Because it feels like, 5-10 years ago, we were talking about kids getting into their parents' medicine cabinet. But this isn't that. This is straight for that purpose. Are they getting it on social media? We sometimes hear that. I mean, are they able to get onto Facebook or any of those apps?
So I don't know about that, but
Yeah.
most of the patients will say that they have these groups that they have communication with, and they will know when a batch comes in. They do not know typically how much fentanyl would be in that tab. So if it's somebody who has used this multiple times, they would probably break the tab and take it to prevent an overdose. But for somebody younger who does not know and has not been exposed to this before, takes the whole tab, is very, very high potential for overdose.
And we've also talked about, because they're made on the street or in these labs that aren't legitimate, you could get half the pill, could have much more.
Yes.
You just don't know. Another question from Amelia. Amelia wants to know, since the patient is pregnant, will the baby be born addicted?
So that's a very good question. The baby will typically, once the baby is born, and the NICU works very closely with us, we always get a consent form signed by the patient, and the patient knows that potentially the baby will have what is called neonatal abstinence syndrome, which means they will not be on buprenorphine anymore once they're born. So they will exhibit some signs and symptoms of withdrawal. But because we already know it's in a controlled fashion, we knew the dose, and the NICU is ready for it, they are already prepared, and they know how to treat that baby for first 5 or 6 days. And then once the baby stops showing those symptoms or signs of withdrawal, then the baby's discharged and they're fine.
Question for Dr. Love from Lucy. Lucy writes, I'm curious if the cardiologist has seen an increase in patients with heart damage or who've had heart attacks from fentanyl.
Yeah, I wouldn't say necessarily an increase in heart attacks or heart damage. As we talked about, there's no specific mechanism where the heart is damaged. If you have other things going on with your heart, blockages in your heart arteries, or other things that impair blood flow in the heart, and you reduce your oxygen capacity by decreasing your respiratory drive, it certainly can have adverse effects on your heart. But I wouldn't say it's something we've seen an increase in recently. Typically these patients are younger and don't have those other things like coronary artery disease.
Another question for Dr. Love from Jill. Jill wants to know specifically about fentanyl that's prescribed in a safe environment. She wants to know what kind of patients would be prescribed fentanyl in a hospital setting, and why? Who would prescribe it?
Yeah, so physicians prescribe it, and it's often used as a pain medication in the hospital. Like we talked about, it's a very strong pain medication, and people are, in significant amounts of pain do really well with this. We also use it as a sedative. It's part of how we give anesthetic to people if we're doing procedures or that sort of thing. We use it pretty frequently in the intensive care unit when we have people who are intubated or on the ventilator to keep them sedated. So it's an excellent medication that we use in the hospital, typically in an intravenous form. Very different than what we're talking about with these tablets on the street.
And you'd be surrounded by doctors who have a specific controlled amount, and you're in a hospital.
Yeah,
so
and it's not typically an oral,
Right.
pill medication that we use in the hospital like we do with other things like morphine and oxycodone. And this sort of.
Got some questions coming in right now on Facebook. Jan Carlos wants to know, are there any, and I don't know if you would know this specifically or not, but I'm going to ask, are there international studies on the factors that are causing fentanyl addiction in the United States? Would you know to speak to that?
So there are not, I don't know about international studies, but there are a few studies that they have done. Actually, one came out of Washington area that we recently reviewed. They looked at the fentanyl that was available illicitly versus the fentanyl that was being prescribed in the hospital. And they found, at least in this study, they found that the fentanyl in the hospital was the one which was fentanyl, then metabolizes to something called norfentanyl, and that's it. Whereas these had different fentanyl analogs. For instance, they had some of the common analogs are like acetyl fentanyl. Furanil fentanyl is something that has started coming up in these samples. And when they look at the potency of this furanil fentanyl, for instance, it is 7 times more potent than the regular fentanyl.
Wow.
So that is why, one, the addictive potential, second, the reason for overdose.
Another question to follow up, it was Juan Carlos. Is there an antidote for fentanyl?
Absolutely.
What's the antidote?
Naloxone or Narcan, is what we should all have. We talk a lot about it. We tend to tell our patients, take Narcan from us. We tell all physicians, if you are prescribing any controlled substance, give the patient a Narcan, just in case. And it is life-saving. It is mostly for fentanyl patients. Most of our patients say that they end up using both. There are 2 doses in it. They end up using both of those doses. And
Wow.
if you find somebody unconscious, do that and then immediately call 911 because they might need more.
And Dr. Love, you're nodding your head yes on the Narcan.
Yeah, I mean, it's something we certainly use, in the hospital floors as well when people, have come in with overdose or if they were to get too much narcotic. Yeah.
A question that was emailed to us from Jamie for Dr. Sethi. Can someone get addicted by just taking 1 pill? And this is a good question. I was wondering this. Is it the fentanyl itself that makes it more addictive, or is that just an additive?
So I don't think getting 1 pill can make you addicted.
Okay.
It's just that if you look at it compared to a normal fentanyl, the amount of things or activities that are happening at the receptor are much, much more potent. So euphoria is what people mostly take it for, is also going to be more intense with this fentanyl that we are using illicitly, which will now cause the high, as the word is, to be better. And that is, most of our patients tell us that that's the high that they're seeking over and over again, and they never get it.
That's what our patient said that we interviewed.
Yes.
She's chasing that.
Yes, chasing that high is exactly what we hear all the time. 1 pill is not as addictive as I would say 1 pill can definitely cause an overdose because of the kind of fentanyl in it.
Another question that came in is, are there signs that you can look for that someone is using or on fentanyl? What can parents watching or really anyone watching, if they're wondering if they have a loved one that's on something like this?
So in the clinic, we look at eyes. And if you look at their pupils, the pupils when you are on fentanyl or any opiate, you will have very, very small, which is also called pinpoint. Like you cannot see anybody's pupils when they are actively using this medication. Another thing that we look at in the clinic is whether they're in withdrawal. One of the withdrawal things is while it was pinpoint or very small when you were using, they become very dilated when you are in withdrawal. So another way of looking at it. Also, if the person looks very sedated or sleepy all the time, is very tired, looks happy, and that's not like the general presentation of that person, and looks different from their general personality, I think that should raise suspicion and make sure that you at least get some help to find out what's going on.
When, Dr. Love, when you started med school, this probably wasn't on the radar. I mean, we're doing an entire episode on fentanyl. Is this something that's regularly talked about now that you hear in your doctor circles?
Yeah, probably not specifically in cardiology,
Right.
but yeah, I mean, it's something that's permeated the medical community over the last 5-10 years. Not just specifically the fentanyl, but just all of the opiate addiction and
Right.
Everything. So yeah, we routinely discuss it.
Lindsay has a question for you, Dr. Love. She wants to know if fentanyl can cause lasting problems even after someone quits.
To the heart, I'm
to the
assuming,
heart,
yeah,
to the heart,
specifically.
yeah. Could it cause a lasting problem?
Yeah, so I don't think that there's any hard data that that's the case, to my knowledge anyway. That you can have effects from these medications that cause low blood pressure, they can cause you to pass out, your heart rates can be lower. But as far as long-lasting damage to the contractility or the ability of the heart to beat strongly or to the heart arteries, I don't think there's any clear data that that's the case.
Kim Moore Bosley has a question for Dr. Sethi on Facebook. Is it true that fentanyl, and you touched on this a little bit, that fentanyl is 100 times more potent than morphine?
It is 50 to 100 times more potent than
50 to 100 times?
No.
50
to 100.
Oh, 50 to 100. Okay, I was like, holy cow. Okay, so it's 50 to 100 times more potent than morphine. That's wild. That's just, that's stunning. How many patients, and are you allowed to say, have you had that are pregnant?
So we get a fair amount of pregnant patients. I had special interest in pregnant patients who were addicted to opioids. So we, over the years, have had a couple of patients. We work very closely with the high-risk OB, and as soon as we get a pregnant patient or one of our patients get pregnant, we involve the high-risk OB and we work very closely with them so that the baby is born safely and that there's no neonatal abstinence withdrawal.
Are you able then to share information with each other, the OBGYN, and you can kind of tag team to protect that baby?
We are one big team. So the high risk OB, us, and then neonatology, we work as a team so that we can be prepared of what we want to do. What do we want to do with if they're on buprenorphine? What do we do with buprenorphine at that point? If they're on methadone, how do we work with methadone with these patients? And then as they go closer to their due date, what do we want to change? And after discharge from the hospital, they come back to us.
Dr. Love, have you ever referred a patient, or do you recognize the signs enough to know I've got to refer a patient to Dr. Sethi? Like, what would you do if someone came in and you could tell they were addicted to something?
Yeah, that's exactly what we would do is make that referral. It's not a common referral out of the general cardiology clinic. Most of my patients are 65 years and older. I mean, we definitely take care of younger people, but an older population, so it's not something we frequently do, but yeah, we would refer.
And that goes along to our question from Ron for Dr. Sethi. He wants to know, how does someone get into your clinic? And do you have to have a referral, or can you just call?
Call our clinic. We have a pretty open door policy.
Okay.
If a patient walks to our clinic and says they're an opioid withdrawal, we'll take you. We'll take care of you. We will admit you.
We're showing a number right now. I want to say it for the people who are watching or listening to this in a podcast form. The number is 913-588-6493. That's for those of you listening on a podcast form. And you just opened up even more spaces in your clinic.
Absolutely.
How many more you said you were able to
We can take up to 200 or more patients on buprenorphine. We also have a very robust methadone clinic. So if somebody's looking for methadone, we are an opioid treatment program as well, and we are open to admit there as well.
I want to give our viewers a little more perspective on fentanyl in our community here in Kansas City. The Kansas City Police Department tells us that just last month, officers seized huge amounts of fentanyl on 4 different occasions, a total of 17,400 pills, along with 2 bricks, 2 kilograms in brick forms. It was all headed to various parts of the U.S., including right here in the metro, fanning out to our whole area. Families across the area are being affected by this. And Dr. Sethi, you were talking about Narcan, so we want to talk about that because Narcan is the only FDA-approved nasal form of naloxone. It's for the emergency treatment of an opioid overdose. You can use it at home without any medical training. That is so important. All major pharmacy chains offer Narcan. There's a statewide order that allows you to purchase Narcan without an individual prescription. And if you have any questions about Narcan specifically, you can call 844-4-NARCAN. Dr. Sethi, again, your take on Narcan. Who should have this in their medicine cabinet?
Everybody.
Like even if you don't think you know someone
Yes,
who's addicted to opioids, you should have it?
Absolutely. I have had patients come and tell us, thank you for giving me Narcan. I didn't use it on myself, but I had a family member, or I found a neighbor who had passed out, and I ran with my Narcan. And guess what? Nobody knew that he was having problems with opiates. So it does save lives.
What happens if you were to use the Narcan on someone or yourself and it turns out you weren't suffering from an opioid overdose? Would that be harmful?
It will not be harmful. So what it'll really do is it'll go to the opioid receptor and just go and block that. If you were not taking an opiate, you're still blocking it and not doing anything different.
So it's one of those drugs where there's no harm. It's one of those antidotes. Rather, that there's no harm even if you're not suffering an opioid overdose. Okay, that's really good to know. I want to first of all, thank you both for being here. You're super busy doctors. You took the time to come down here. I want to ask your final thoughts. I want to start with Dr. Sethi. To the people watching, maybe who think this wouldn't happen to them or their family or their kid.
It is very prevalent. We need to talk about it to our kids. We need to bring it forward as a family, open it up, and seek treatment. A lot of people think I can do it on my own. I would highly suggest get on medications, get treatment, and then when you're ready, you can come off of the medications and do it on your own, but seek treatment of some sort. If you think you have a family member that might be addicted or you're worried, you can always call and ask for a referral and just get a second opinion, or you can have your primary care evaluate them, but get treatment if you need. And if not, if you have somebody that you know who's on an opiate, buy a Narcan and keep it at home.
Dr. Love.
Yeah, 2 points. I just wanted to echo something that Dr. Sethi had said earlier. If you do give Narcan, it's not an antidote that lasts forever. It's a shorter acting antidote, and so you still need to call 911 and have the person evaluated by medical personnel. They may need more Narcan going forward. And then the second, I guess, final thought is just to kind of echo everything Dr. Sethi said. I mean, this is a wonderful resource to have this team here at KU, and people, help is very important when it comes to addiction, and doing it on your own is near impossible. And so seeking help and getting treatment is how you treat this disease. And so use Dr. Sethi and her team.
All these doctors, all you guys working together to help someone. One patient can then be reached by so many different specialties.
Absolutely.
Thank you again. This is super important. And thank you for taking the time to watch our broadcast today and joining the conversation. And if you continue to send more questions, I will be sure to forward them on to Dr. Sethi and Dr. Love. Coming up next week on All Things Heart.
I was really scared, but I had a very strong husband who said, God didn't give us anything we couldn't handle.
And now this amazing dancer is living her best life. As you can see, this story has a very happy ending. But for her mom, her birth was scary. The resources right here at the health system to help her live a full life. Next Thursday morning at 10. We'll see you then.